The tablet or the spray?
The tablet, even the spray, she has it too.
Okay. Okay, so this is, we're going to look here and we're going to compare what the pharmacy has sent us with the order that you have from the doctor. And then we're going to, we have 3 options here that we could choose from: update existing, add new, or reject an order. Update existing would be if we already had medications on her medication list, we would have the drop-down options and we could choose it if it was, a matching medication. Since she doesn't have any medications yet in our tasks, we can list this as, process it as adding a new medication. So I'm going to click this button. Then a few more fields will open up here. And you can choose whether this is a scheduled medication or an as-needed medication, just like when you add one manually. You will choose the date and time this will become active for your staff to be able to give. And again, this is not the date and time that it is to be given. It's just the date and time that it shows up on the Today screen for staff to be able to see to administer. If there was an end date and time, such as an antibiotic or something that had us...
Hold on 1 second. This one,
Sure.
if they want to schedule right now, we have to put it just 1 hour before. Like, if we want to schedule right now, you put it 1 o'clock.
Yes.
Oh, yeah.
You, very good memory there, Jama. That
Okay, good.
was wonderful. I did forget to say that. Yes, if you want this to be able to be seen immediately, you'll have to back it up an hour because the system automatically will just put the time to the next full hour.
That's the full hour, so they can give it to them. But if you want to give them in the future, then you can put it another time. We already talked about last time video. Okay, go ahead.
Yes, and then you could choose your end date and time if that pertained, say, for an antibiotic or something. And then you will choose if this is going to be given daily or less than daily. If it's going to be given maybe more than daily, twice a day, 3 times a day even, you would still choose daily, and you would just choose as many times as you needed to be able to give that medication. You also have the option to choose a specific time, such as, 2 p.m., 8 a.m. What time does this resident take this medication?
10 a.m.
And she gives this one herself?
Yes.
Okay, so then you can put self. Medications that are assigned for them to give, I believe they don't show up on the Today list, correct, Heidi? Or on the Today screen?
Right.
Yeah, because they're giving them themselves, it's not going to show up for your staff to have to give those. And then your setup. Does the nurse review the medications, or does she review them herself?
Yeah, the nurse.
Both of us do, the nurse and the resident.
Okay. And then you'll need to put an indication as to why she's taking this. What do they have listed the reason why she is taking this?
Is that allergy or I take that one, so
I'm not sure exactly what is her reason for it.
Okay, because fluconazole is an antifungal medication, and it looks like she takes it daily, so I'm not exactly sure. Well, this is a required field. You will need to put something in here in order to save it. And if you aren't sure, you could always, fax the doctor or ask them, and then you can update this later to enter the reason why she's taking it. But you will need to enter something. You could enter a period just to, get something in that field so you can save it. But you will want to find out why she's taking that and enter the reason, because the surveyors, when they come, they will look at that too.
Okay.
they have to see the surveyor. The government, they have to look at.
Assist is who is giving this medication to the resident, and we will put self here as well. administration note is not required, but you could make it required if you had something that was an injection or a patch. You could put, have it be required to save or enter what location it was placed in or the injection was given. And then obviously you can change the route if needed. It came over as by mouth from the pharmacy. If it's a psychotropic medication, you could click the box here, antibiotic or controlled medication. And then if it's crushable, if she needs it crushed, you can check that box. Hide on EMAR, again, we talked about this a little bit last time. That would be something such as like a glucose testing strip where you may want it on her medication list so you can get refills from the pharmacy, but the staff doesn't need to sign off on a glucose testing strip necessarily. So that could be one that you would want to hide, but for the most part, all medications would usually not be checked to be hidden. And then you just want to look at these administration instructions and make sure that they are matching what you have, that she's supposed to take 1 tab by mouth once daily. And are those instructions correct there?
Yes.
Okay, then we can save this. You have a resident that you guys have gone in and entered the medications on?
Yeah, JC. Which one?
The one I've gone?
What do you look at? What do you say?
Leave absent? No.
Which one?
Have you entered medications, like have you manually entered medications on anybody?
Yeah. Let's say JC.
No.
Huh?
No.
Huh?
We've not done any manual medication entry yet.
Okay.
For what?
That's okay.
Even if you said if you get the medication from the Walgreens.
In our times, we've not yet.
Artas kumagli send the one from push
We have not.
Oh, our task. We did not put all the medication. Maybe she did. Did you put some medication there? Can you see, Anthony, if you have any medication there?
I haven't seen any yet. No, that's why I was asking. And that's okay. You don't have to. We can import them all from Pharmacy Connect. I just wanted to show you what it would look like if you were.
So that is the pharmacy connected. What you just showed me. Don't that is his medication there, but it's not connected yet. Is that what you're saying?
Well, it's connected, and that's what we're doing. We're moving it from this Pharmacy Connect tab to the medication list.
I see. Okay, good. Okay.
So now, and you said she is taking the spray as well?
Yep.
Yes.
Okay. So you can look here, it says it's a 50 microgram spray, 1 spray each nostril twice daily. Is that the instructions you have?
Yes.
Okay. So now I just want to show you this, and we're not going to merge them, but if you had, see how this says update existing? If I had that spray already in there, see now you can see the medication that we added is available on this drop down. And we would be able to select that and compare it and see if what they have is what we have and if they match up. Now this is going to tell me this is a different medication because one is a spray and one is a tablet. So we're not going to merge these together as one. But that's how you would do it if you did have one that was.
But if the tablet and the other one, no, the same name but it's a different. One is a spray and one is a tablet. Okay.
All right. So that's how you would do that. Now, this medication that you don't know for sure if she's taking, this ferrous gluconate, if you verified that maybe this was an old medication and she no longer takes it, you could click to reject the order, and you can put a reason such as discontinued or whatever the reason is. And you can confirm that, and it just won't add it to her medication list, but it also does not send it to the pharmacy to let them know that you rejected the order. Pharmacy Connect is a one-way communication system from the pharmacy to your RTASK's database. But if you did reject the order because it was discontinued, you could then print out a report that is rejected medications, and it would have on there the reason that you listed, maybe it was discontinued, and then you could fax that to the pharmacy so that they could update their list. Does that make sense?
Yeah.
Okay. I'm just going to make sure. I thought we medication, once you decide what you're doing with these medications as far as updating an existing, adding new, then the rest of the process is very similar to adding medications manually. It's just deciding whether you're updating an existing medication or adding new or rejecting a medication. So it's this one that is on Margaret's as needed medication list, the acetaminophen 500 milligram tablets.
Yes, she has it.
Okay, so we don't have it listed yet in our tasks, so we're going to add it new. And it already defaults here to the as needed. And again, the active date and time, as Jama mentioned, if you wanted this to be able to be seen immediately, you would need to back that up a little bit in time. And then the other thing that's just a little bit different here is, again, adding whether it's every X number of hours as needed or up to X number times of day, X times a day as needed.
You can learn
And
this one from my previous.
so right now,
last
this
week.
says is
That's what she.
take one tablet by mouth every 6 hours as needed for mild pain. That's the instructions the pharmacy has. Is that the instructions that you have from the doctor?
Yeah, it's correct.
Okay, so I'm not sure why this says up to 1 times a day, but we're gonna get rid of that. And over here where it says up to every 6 hours, we're gonna add that so that it
If you
is
don't want it,
correct.
you have to put the X there. Okay, if you don't need it. If you don't want it.
The system defaults to have either one or the other, not both of these. So this will have an X in the one that
You have to use one of them.
you don't enter. And the nurse reviews those with her. Is this correct that it says she's taking this for mild pain? Is that the indication you have as well?
Yeah, it's for pain.
Okay. What if I can spell correctly? And she does this, does she do all of her medications herself?
Yes.
Okay. This says not required for an administration note, but the system will always require a note for as needed medications, just because we want to know why they're taking it since it isn't scheduled. And then we have our instructions down here. And again, you could check any of these boxes if they were applicable. And then you just click save. So any questions on processing the Pharmacy Connect medications?
How we, in the future, like personality, how we going to charge them in the system?
You can put in a new one.
How we going to charge the
She's asking
system?
about pharmacy.
Yeah.
About the pharmacy medication.
No, but
No, I think it's right. So to process them, I go to Pharmacy Connect and look at the medication that is there. If I verify that I have it in, then I will create as new medication.
New app, yeah.
Yeah.
Okay.
Yep. From that drop down,
Mhm.
you would want to choose. Do you have certain days that she takes it?
That is what I don't know. Probably we can pick a medication that has enough days, that is more specific. Because this one I have to find out what days she takes.
Well, you could, yeah, and you could put every X days, and if she takes it, say, twice a month, you could do like every
No, not
14
this
days or every 15 days.
Go back. Every X.
And what you would do is you'd want to make the active date the date of the first dose, and then go every 14 days from there, if that makes sense.
Okay. But we don't know what.
Yeah, so if you're not sure what day she takes this, you might want to wait to process this one.
Yeah.
It's just a little bit harder when you're not exactly sure. That way you won't have to go in and correct any mistakes. So maybe we'll just hit cancel on this one. It looks like this particular resident has a few medications that you may need to kind of look into since she takes them herself.
Pick another resident.
in case somebody needs stuff like that.
So this is the day. This is for
That
today.
is-
This is for today. The time is today, right?
Yeah, that's the date and time that it could be seen on the to-do list, on the today screen. And then that's the time you're scheduling it for, to be given.
There are 2 people
And you'll want
supposed
to
match.
assign that to a provider too, for that 8 a.m. So this means the RN is giving the pills.
So the person who gives the pill is the aide, the home health aide.
Okay, so then that would be your overnight. The system has calculated that this is part of your overnight shift because I believe it goes, when we set it up, I think it goes until 9 a.m. Is that
Yes.
correct, John? Yeah. And if you have the indications on the diagnosis list, you can choose that from a drop down. Otherwise, you can free type in the reason if the diagnosis isn't there or the indication isn't there.
I know that he has hypertension and he takes it for his heart. So do you want me to still put the hypertension or for cardiac?
Well, honestly, the doctor will need to give you a, what I used to see come in when I worked at the clinic was the list of medications would come in and they would say, please indicate why the resident is taking each of these medications. Whatever the doctor says that they are taking it for is what you'd want to put in this.
Okay,
in
I
this-
know we have that on file, and that file is not where we are. So that's why
Oh, that's
I
okay.
can
And
still
you
go
can,
back there later. And
yes, but you'll need to enter something in that box to be able to save it. So even if you just put a period or a letter, and then if you just make note that you have to go back in and update that once you get the information, then that's perfectly fine.
Okay. Okay, then we'll save it.
Yes. Perfect. And now it fell off of this list and went onto the current medication list. So any questions about? And then I know last time we talked about entering services for each resident.
Yes.
And it looks we have some services entered, so that is great. The other thing we want to look at is making sure that they each have specific instructions in them. Let me show you kind of an example here. Where did I go with that one?
Yes, I think that's the nurse will do that.
Okay.
And she
Yeah,
and
so
she
let's-
and she have a little bit little experience with the art task. So she worked before.
great.
So she will help us for those needs because everybody's different.
Okay, perfect. Yeah, because these behavior services, they'll just need to be edited so that we'll have the description of the behavior, the goals that you want for this resident. If you know of any triggers of the behaviors. the
Yes, we do.
interventions
Yes, we
you
do.
guys-
Yes, we do. And they need that all the time. Right now, we cannot even do the 60 RMS worksheet with us those information.
Okay.
Yeah.
Yep. So just wanted to remind you that
Yes,
I know
sure.
you guys are very busy, so we'll just have to make sure that.
Okay.
we
Yes,
can keep
we'll do that today.
So, Yep. All right, so we clicked on Robert's profile, and down here we'll click on medications. He just, this is your test campus, so there's already a couple of medications in here. So this is what it'll look like when we start adding the medications. I'm going to go over these tabs here. This is current medications. This is the full list of medications that he has right now. If he had any as needed medications, they would be listed down here. And we can enter one as an example so you can see how that works. But you'd see the full list of medications. Schedule shows just the schedule. So if you wanted to add medications manually before you get the information from the pharmacy,
Sure.
you can do that. We'll go here to add new medication, and this pops up here where you can start typing in the medication name. I'm going to put in just a as needed medication here for an example. I'm going to choose Tylenol. See how we start typing and then these options pop up?
Yes.
You'll want to choose, one of these from the list.
Yes.
That if it pops up. If it's not on the list, that is okay. You can still enter it. You just want to make sure you have the correct spelling and grammar. So
Okay.
we'll choose Tylenol. The strength is the strength of the medication. This per tablet or per like if I had a 300, well, let's say I had a 500 milligram tablet. That's where we'll enter that here. The route, if you have those all grouped together in the one bubble, you're going to choose by mouth. An as needed medication is not grouped in that bubble because we don't know when that resident will need that as needed medication. So in that case, we will choose by mouth, not from dosage box. So your staff will know that that medication is not included in that bubble.
Yeah, it's gonna be BRN. Okay.
Yes, and then we'll change this from scheduled to PRN. And that changes a couple of the things down here as far as scheduling goes. We're not scheduling a certain time because it's as needed. Indications, we'll need to put in here what this medication is being taken for. And usually the doctor will give you that reason. They'll say
Yes.
to take this for pain or fever. Whatever the reason is, you'll need to enter the indication.
Exactly.
If you have the resident's diagnoses listed on their diagnosis list, you can click this and it will give you a list of their current diagnoses. And if it's one of those reasons, you can just click on that and it will add it to that. Otherwise, you can also free type.
One more I have a question then.
Sure.
So this one, once we save it, what about if the Geraton send it through their and feed to come back here, and don't you create a duplicate?
No, it won't create a duplicate. It will be easier to explain once we have that set up, but it will send you an alert and tell you how many medications the pharmacy has sent through the system. And then what happens is we go into the Pharmacy Connect and we will compare the medications they sent with the ones we sent. And if they're already on the resident's medication list, we merge them together to create just one medication.
And that training, when is gonna be that? When are you gonna show me that?
Well, I will have to send send the request to Geraton.
Yes, later on. Okay, we'll do that. Okay.
Yes.
Fine.
Yep, we will do that.
Okay.
Yep.
Okay.
Oh, so we put in our indications here why this resident is taking this. And then our active date and time is not the time the resident takes the pill, but this is what time is this going to show up on the MAR, on the medication record for the staff to be able to give. When did this become active for staff to give this to the resident? So our system will default to the next upcoming full hour. So right now it's 2:20, so it rounds it to be able to be seen at 3 p.m. If we have a medication that we want our staff to be able to give right now, we would just back this up to the previous hour so that it will show up immediately for staff to be able to give. Does that make sense? It's not the time we're giving it, it's just the time that it's going to be available for staff to chart.
Okay.
If we had a medication that needed
So
an end date,
can we change it that active date to instead 27? Can we just say 28, something like that?
if you want it to not be able to be seen until the following day,
Yes, you can do that. Okay, okay. Good.
you can do that. So say you have a medication that's not scheduled to start until Friday. You would choose Friday,
Yes.
and then the time prior to the time you want it to give to be, to
Yes.
be,
Hold on 1 second. Hello? Yes. 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 Yeah. Oh, okay. No problem. Just email me. Okay. I'm in a webinar. Okay. Okay. Go ahead. Sorry.
Okay, no problem. So yes, if you have a medication that's not due to start until a future date, you can definitely choose that date and time. The system's not going to let you go back because we are not going to be starting a medication in the past. All right. So if you have a medication that has an end date, such as, an antibiotic or something, you could put the end date in here, or you could select 7, 10, 14 days, however many days the order says they are to take that for, and it will calculate that many days for it to stay on for staff to chart, and then it will be discontinued after that time. Since this is
So it automatically will discontinue, or we have to ask to say discontinue, or we just automatically will discontinue?
If you choose an end date, it
Yes.
will automatically
Good.
discontinue it after that date.
Good. Okay.
Yeah. So we're going to leave this blank though, because this is an as needed medication and we don't have an end date or time.
Antibiotic. Okay.
Yep. And then these two boxes here, every X number of hours or up to X times a day, you only put in one of these options based on what the doctor says. If the doctor says he may take this up to 3 times a day, we can put that in here. The system will calculate that should be no more than every 8 hours. You don't need to put every 8 hours here and every 3 hours here. I don't think it will even let you save like that. You just choose one or the other. Does that part make sense?
Yes.
Okay. Your administration here, set up, I know the pharmacy sends you the medications, but do you have a nurse that reviews your medications and makes sure that they are accurate as to what the doctor has ordered?
Yes.
So then this would be nurse setup. And that just means that the nurse is setting up and reviewing that, they're the correct medications and everything. Assist is who's going to be giving these to the resident. If they're giving them their own medications, that would be self. If their family gives, in your situation, family probably is not going to be giving them medication.
It's a ULP. It's going to be...
Yeah, it's going to be the ULP.
Yeah.
Unless, say if there's some sort of injection or something that the nurse gives, then you would choose nurse.
Of course,
for that.
of course.
For your pills, you would just choose your ULP.
Of course.
For an as-needed medication, an administration note is always going to be required, and that's just going to make the staff put in the reason that they're giving this as-needed medication. They have the reason up here that they should be giving it, so then that reason should be matching what they're typing in as to why they are giving it. So note will be required on an as-needed medication. verify at administration means you want your ULPs to verify that, they want to do their checks and make sure that they have the correct resident and the correct medication. They're giving it at the correct time. So that's what that is checked for. And that will have them check a box that says, yes, I am verifying that I'm giving the correct medication to the correct resident at the correct time. If this were a psychotropic medication or an antibiotic or a controlled medication, you would want to check this box. That will help to pull some different reports if you're tracking controlled medication use, psychotropic use, antibiotics. It will also require, if this were a controlled medication, it will require staff to count the medications. If you want them to do narcotic counts every shift, or when they give an as-needed controlled medication, they'll put the count in as well.
So if you click the control, is still the verify administration is going to be still there?
Yes.
Oh,
yep.
Good. So it's a two different thing. Yeah. Okay, I got it. I got it.
Yes, you could mark any number of these if they pertain.
Yeah, like standing orders. Okay.
Yeah. Yep. So since this is Tylenol, we know that it is not psychotropic, antibiotic, or a controlled medication. If you had orders to crush the med, you could click that box. We don't want to hide this one on the MAR because that hides it from staff being able to give it. The only time you would maybe click this button is if you had something on the medication list, such as a glucose testing strip, because the staff don't need to sign that off on the MAR, but it may be on their medication list so that it can be refilled from the pharmacy.
Mm-hmm.
All right, and then you would put in down here, the nurse will put in specific instructions to the staff. So let's say, I could type here. You can also type other information in here, such as, notify RN if pain is not relieved after 1 hour, or you can put any other information in here for your staff to see. If it was a heart medication, you could put notify RN if heart rate is less than 50 and hold medication. You want to give your staff specific instructions as to what to do for this medication. If you had your pharmacy, if we had our pharmacy listed here, that we could choose that. If we knew the RX number, we could put that in. These are not required to save it. If we had the prescriber name, we could choose that. And then we will click save to save the medication. So now you can see on the current medication list, we have our scheduled meds up here, and we have our as-needed medications down here. So again, we are in the profile,
Mm-hmm.
and we go to medications,
Mm-hmm.
add new medication. Let's add, we can add we'll say he has a scheduled fentanyl patch. So this one is a controlled medication.
Mm-hmm.
We'll say 25 micrograms is his strength. The route is transdermal. We'll say it's scheduled. Indications.
What is that? What does that mean? Root transdermal. What that mean?
So transdermal is for a medication patch. So fentanyl sometimes will come in a patch.
I see.
So if you, like even a nicotine patch or any other medication patch,
Yeah.
that route is how it's given to the patient. And
I see.
transdermal is on the skin,
Sure.
through a patch, or through the skin, I should say.
Mm-hmm.
We'll say it's given for chronic pain. We'll make this active date and time. We can say that this is going to start tomorrow morning. If his meds are scheduled at 8 a.m., we will make this available for staff to see at 7 a.m. just so that it will be available for them to give for that 8 a.m. dose. We'll say this is ongoing, so we don't need to put in an end date or time. Medication will be provided. So see how this looks a little different than the as-needed medication where you put in either how many hours or how many times a day?
Yes, but you have to select it and schedule it, right? Not BRN. Schedule. It have to be scheduled.
Yep, this one is scheduled.
Yes.
So for when we schedule this, if it's daily or more often than daily, such as twice a day, 3 times a day, we would choose daily. If we needed to say it was 8 a.m. and 8 p.m., we would go here and we would choose the first one, 8 a.m., and we're going to choose the provider that will be giving that. That'll be the day shift. And the system knows that based on 8 a.m. that's the day shift. Then we would click add new time, and then we could choose 8 p.m., and then that's the evening shift. If we had a medication, usually fentanyl is a patch that's given every 3 days. So we would choose we could do every X days, and it would be every 3 days. So you can choose from the drop down here. Maybe it's something that is given once a week, then you can choose that and choose which day it's given on. Or if it's given maybe 3 times a week. So you have a lot of options as far as being able to schedule the medications exactly how they're ordered.
Mm-hmm. So then after that, I have to say, let's say I choose it Thursday on Friday, or something like that. Then should we have to add and add new time? Yeah.
Okay, so
choose multiple.
Yes. Yep. If you're giving it once a week on Friday, then we would add what time on Friday.
What about it's a 2 days? If it's a 2 days.
Sure. Then you'll pick if it's given at the same time on both days.
Yes.
Then you would do that. If it's a medication that's given, say Friday morning and Monday evening,
I see.
then we would enter it as 2 separate medications.
Time. Okay.
It would be a different medication.
Okay.
If it was at a different time weekly here.
Okay.
But if it's at 2 different times on the same day, or if it's at the same time every week, does that make sense?
Yes.
Okay. So we'll say this is given every 3 days. We can say that it's given at 8 a.m. If you want to look and see what time your resident is currently getting medications, you can see, they're getting these medications at 8 a.m. and these medications at 8 p.m. by clicking the show current schedule. And that way you'll know, if you want to schedule them for the same time.
Same time, yeah, that makes sense. So you know what they scheduled for other one. Yes, yeah, okay.
Yep. Simplified time means either AM, bedtime, midday, overnight. Usually with medications, they're usually at a more specific time because medications themselves are usually more time sensitive as to when they're given. If this is scheduled for a simplified time under this drop-down list, your staff has that entire shift to be able to give that. So that's really not usually appropriate for a medication. We usually will choose a specific time for medication.
Sure.
Okay. So setup will again be the nurse, if the nurse is the one verifying the medications that are sent from the pharmacy. Assist, is probably going to be your ULP. Administration note is not required when you're scheduling a medication, but you can make one required. In this case, since this is a patch, maybe I want to put on here that a note is required so I know where that patch was placed. If I know the patch was placed on the resident's right arm, I can, have something scheduled to remind staff to make sure it's in place each shift. So that's a nice way to know that where they need to look to make sure that patch is in its place.
Yes.
So then when they chart it, they'll chart where it's located. And then you notice this controlled medication, this is already checked.
Yes, that's what I was wondering. Yeah, because they know the medication. Yes. So, okay.
Well, yep, show you. It's on your, what we call your global medication list. When we started typing in this box up here and we were able to choose from the list of medications, that pulls from what is known as your global medication list.
Yes.
And that is effective for across all 3 of your campuses. And I will show you how to look at your global medication list, and then you can add or edit or make changes to it if you need to.
Sure.
So then we would put our administration instructions in here. And again, you can put whatever instructions in here you need your staff to know for this medication. Heidi, do you normally see if it's a patch, do they usually put in a separate service to remove the old one, or is that usually included in when they place the new medication?
Something like fentanyl where it's...
Yeah, that's exactly the one I'm doing right now.
That would be fine. You don't need a separate service.
Okay, so you could, you could put your instructions to your staff in here to remove old patch.
Perfect.
Yeah. So any details you need them to know. And again, if this was a medication that was sent over through Pharmacy Connect, they would already have the pharmacy details, the
Sure.
RX number, and the prescriber. And then we can click save here. So now that is on the list here.
Schedule it. Yes.
Yes. So your global medication list that I was talking about, in order to view your global medication list, you click on the Today screen and plus more. And down here under administration, we have the global medications. And this is the list of medications that the database is supplied with. Some of the medications that are known to be controlled have already been checked as controlled substances. However, if there is one that you find is not checked, you can always check that if you're wanting your staff to count that. You can, if you need to mark something as an antibiotic and it's not marked, you can do that. You can search up here for specific medications. So let's say fentanyl, like we just did. It will show you over here. These are actual brand names that are known to be fentanyl, and then we have some generic. So it gives you, shows you a lot of options, and you can see they're all marked as controlled as they should be. It also tells you right now we have this one in use one time. So that's the one we just did that we just assigned to that test resident.
Okay.
If you have maybe a brand new medication that is not on the list, you could either enter it like we did, or you can come here and add a new medication to your global medication list.
Oh, it's okay.
Okay?
It is not there. Okay.
Yeah, yep. Yeah, so any questions on that? The only people that would be able to edit your global medication list would be the users with the 411 role, and I believe
Can you search like metformin if it's in a list?
Yep. So any medication that has metformin in it, because a lot of them are combination met.
So all of them, and they have it. Okay. So
Yeah.
they have a lot of names, different names. Okay.
Oh yeah, yep.
I see. I see.
But not all of your staff will be able to come here and
No.
manage things.
No.
You have that 4-1 role, so you will be able to do that. Trying to think, I was going to say something. I remember what I was about to say. Oh, once you do get Pharmacy Connect, this you will see here like a little blue number that will tell you how many medications the pharmacy has sent over, and this is where we will go once we have that set up, and I'll show you how to merge them into the existing medications or add them new. This blue question mark here, anytime you see this blue question mark, you can click on it, and it will give you links to our support documents in how to do different things. So like down here, how to enter as needed medications. And
I
if
see.
you forgot how to do that, you can click on that, and that will take you here to our support site, and it will give you step-by-step instructions in how.
I see.
If we needed to edit the medication, we can click this box here. So again, we were on the medication list, and we clicked into a medication, and if we click edit, that will allow us to edit some of the information on here. There's strength, route, the indications.
And only this one can staff cannot do this one, right? The staff cannot do. You have to be administration, right?
They would have to have the role to be able to add and edit. Let me show you on a staff profile here.
In today's training, we're going to go over how to enter a scheduled or PRN medication. First, you're going to click on Profiles and Residents and get to the resident's profile. Once here, you'll click on the resident's profile and you will be able to see that you have the Medications tab. To be able to add or edit a medication, Role 3 is needed. To add a new medication, you'll simply click on Add New Medication. Here, you will be able to start entering the medication. Once you start typing a few characters of the medication, it will start to pull from the database the different medications. You can select these medications if appropriate. If nothing shows up, you can continue to type the medication name, and then you'll add that medication to your global medication list. You always want to make sure that the spelling of the medication name is accurate. From here, you'll go on to add the strength of the medication and the route of the medication. You will notice here that you have the option to determine, is this a scheduled medication or is this a PRN medication? When entering a PRN medication, there are additional fields that indicate every how many hours is that PRN medication to be given and up to how many times per day. You want to indicate that, as once that is entered, the staff will get a warning if they try to give that medication too soon or too frequent in the day. If it's a scheduled medication, those fields will not be available. Here, under indications, you'll indicate the reason why they're taking that medication. Do note that you have the ability to select from a diagnosis list here. If there is no diagnosis that corresponds with the reason why they're taking the medication, you can free type in this field. Here you will see that you have the active date and time and the end date and time of this medication. Note that you will not be able to go back and enter a date in the past of when the medication was started. You can indicate a future active date. You also can indicate an end date. For example, if it's an antibiotic and it's supposed to be given for 7, 10, or 14 days, you have the ability to choose that. Note that you also have the ability to indicate a quick select for those dates as well. Medications will be provided allows you to indicate how often that medication is going to be given, whether it's daily or less frequently than daily. This includes every X days, even days, odd days, X days on, Y days off, weekly, specific days, and it gives you the ability to select those specific days, monthly, 14 days on and 14 days off. With the monthly, note that if the medication is supposed to be given, for example, on the 15th of every month, that you will need to change the active date of that medication. So you will come here, indicate the active date is the 15th, and it will change the on the date to the 15th instead. You also have the ability to choose, for example, the first Sunday or second Monday or whatever you prefer. Sometimes when adding a medication as monthly, I like to add every X days. If I do it in the multiplication of 7, I have the ability to keep it so that it falls only during the week. So for example, if this medication was scheduled today, it would fall every 4 weeks on a Tuesday. Here you have the ability to choose between specific and simplified time. Specific and simplified times can be used for medications. We do recommend for medications that specific normally is used. Simplified schedules allows for a broader and more flexible schedule. If you're using simplified times, the meds are not going to be flagged as late, where if a medication is given in specific time at a specific time in the day, the staff will have to add a note if they give it before an hour or after an hour window. Once the medication is an hour late, it will be flagged as late, and the staff will have to enter a note indicating why the medication was given late. The simplified, you can choose AM, PM, overnight, for example. This can be used for residents who have a varied awake and bedtime. You also have the ability when scheduling the medication to look at the current schedule of medications that the resident is taking. This allows you to be able to schedule it at the same time as other medications or note that it maybe should not be given when another medication is prescribed. Once here, you'll be able to indicate the time it's going to be given. If the medication is given daily, but is to be given 2 times daily, down here you will be able to indicate the frequency of how often that medication should be given per day, whether it's once a day, twice a day, or more often. When I indicate that a medication is going to be given and it's already given according to a current schedule of medications here, I can see that they have other medications given at 4 p.m. When I assign the medication at 4 p.m., it's only going to allow me to assign it to that provider. You'll notice if I switch the time of the medication, even if by 1 minute, it will allow me to assign it to other providers. Here, under administration, you will be able to indicate who is setting up the medication. Normally, most often, it's going to be either nurse or pharmacy, depending on how the medications are dispensed from the pharmacy. The assist is going to indicate which provider or which staff is giving those medications, or is it other, or is it self? If it is self-administration of the medication, you would want to indicate self, but make sure that the provider here is assigned to as self as well. When doing that, this medication will not show up on the EMR. If I indicate that the medication is to be given by the HHA, again, you want to assign it to that corresponding provider. Administration notes are not often going to be used. There are situations where a note type can and should be required. And those include injection location, patch location, pain level, for example. When you're using the administration note, I encourage you in the administration instructions to detail what the staff should enter in that note. Verify at administration will allow for the staff to check a box indicating that they have verified the medication. When they verify the medication, they're verifying their medication rights, including right med, right time, and so on. Standing orders means that it's part of your routine standing order or med set. Controlled meds means that that med is a controlled medication and a count is going to be required. When a medication is flagged as controlled, staff are going to indicate how many tablets were given and what is the remaining count of that medication. There are situations where medications that are not considered controlled medications may be flagged as controlled to ensure that they're counted. Psychotropic and antibiotic are used for quality assurance measures. It allows you to track and collect data on psychotropic usage and antibiotic usage. Hide on MAR will hide the medication from showing up on the electronic MAR. Situations that you may decide to do this are for blood glucose testing strips, for example. If Crush Med is selected, that will create a flag on the medication indicating that the staff need to crush that medication prior to giving. In the administration instructions, you want to indicate your instructions on that specific medication. For example, give 1 tablet daily by mouth. Maybe they're giving 2 tablets daily, and you would want to indicate what the strength of that 2 tablets would be in these instructions. You also would want to indicate any special circumstances related to the medication. For example, if they take their medications with applesauce, you may choose to indicate to give 2 tablets daily by mouth with applesauce, or crush the medication, or things that are specific to this resident on the administration of that medication. Here, under details, is where you can enter an RX number and the pharmacy. These are optional fields that will allow the RX number to automatically populate. It may be beneficial to add a RX number if you are going to reorder medications using the RTASK's report medications reorder. Additionally, the pharmacy and prescriber can be selected from the drop-down menu. These fields will display the pharmacy and prescriber assigned to the resident's resource screen. Do note that when a medication is added under Add New Medication, that those medications will also appear in the service plan with a corresponding medication assistance service. move forward to the resident's medication profile. If I add the medication as new, that means that this medication is currently not on the resident's profile, and I'm going to be adding it as a new medication. When you do that, the resident's medication, the medication name, the strength, the route, the instructions, all pull automatically to the medication. You as a nurse then need to update the times, assign it to a specific provider, and then indicate the administration information here. You can update the administration instructions, and then you would hit save. If the medication isn't already on the resident's profile, they've been taking that medication and a medication came over via Pharmacy Connect, it may mean that there was a change to the medication or the medication was refilled. You then will use the option of Update Existing. When you update an existing medication, you need to select here the medication that you are updating the order. So I will find the medication here, and then I have the ability to look at them side to side. These are my existing medication details. These are the new medication details. You can see that information, and then you need to decide, am I going to keep the existing times or am I going to update it to the pharmacy times? Am I going to keep the existing instructions or am I going to update it to the pharmacy instructions? The way that comes over from the pharmacy is the way that it's going to be listed exactly on the resident's medication bottle or bubble pack and such. So you really want to make sure that the information matches as close as possible so that when the staff are giving the medications, they're looking at their medication rights, there's not a lot that they have to question or guess on. So once you update the existing medication, again, you can confirm, and that will bring the medication over here onto the resident's current medication list. Here, when you click on Pharmacy Connect History, it gives you the ability to look at the history of medications that have come over via Pharmacy Connect. You can see the reason why the medication may not have been imported. Here it was rejected because it was a wrong med. Here it was rejected because it was a duplicate, but maybe it was rejected in error. You always have the ability to re-import that medication. So that is the Pharmacy Connect history. You also, if you come over here to the Today, the plus more, under Administration, you have the Pharmacy Connect. This gives you the ability to see that there may be medications that are mismatched, that for some reason when they came over, the system was unable to match them with a current resident. Maybe the resident's name doesn't match, maybe their date of birth doesn't match, and it allows for you to link it to the correct medication and look for those errors or completely ignore it. The pharmacy interface is really just for Residex staff. This is where the interface gets set up, where the facility code gets entered, so this is only handled by the Residex team. Here under Find an Order gives you the ability to search for any orders received via Pharmacy Connect in the last 2 weeks will be listed here. You also can go to Fax, Print, and Reports, and you can review reports in regards to Pharmacy Connect. You'll notice under Categories that you have a category of reports called Pharmacy Connect. Here you can view and see different types of reports to view. A lot of it you can find on your login screen, like if you have this enabled is the Pharmacy Import Unprocessed. You can see the Pharmacy Connect filtered meds, the rejected meds, the Pharmacy Connect history for one pharmacy, the Pharmacy Import History All, and the Pharmacy Import Unprocessed subgroup, and the history of the pharmacy import via one resident. If you have any questions about Pharmacy Connect and the feature, please feel free to reach out to Residex support team at any time. Thank you.
Down here is where you would add in all the medications and assign them for your staff to give. So this is all of the medications that this client takes. You can add a new medication here. and then just fill in all the information. You can make them scheduled or PRN. So if it's a PRN med, you can indicate that here and put in the appropriate information. We can create sets. So if you have like routine standing orders, we can create a set of routine standing orders. So your nurse doesn't have to enter each medication individually. It will pull the whole set into the resident's list. When they add those medications, then it's going to have them set up when and how often it's supposed to be given, and all of that information.
What that mean? Pharmacy connect. Okay, come in. Later.
So Pharmacy Connect is our one-way interface. So if a resident, and we do Pharmacy Connect with Geratom, so we can do that. So this is telling me this client has 13 new medications that were sent over from the pharmacy that someone needs to do something with. So most of the time it's going to be your nurse. So she's going to want to come to this resident's profile. She's going to follow that blue flag. And now when she clicks on this, it's going to show the medications that the pharmacy has on file that they sent to you that need to be addressed. So then your nurse would need to go into each one and either update an existing order. So if they're already on this, they can compare them side by side with the medication that they're already on that's the same as this, and decide which one they want to keep, or if they're going to, merge them. They can add it as a new one and set up the schedule and assign it for someone to give right from there, or they can reject it, so that if it's something that's happened in the meantime and that resident's no longer on it, they can just reject it. When they reject it, it doesn't notify the pharmacy. Your nurse would still need to call the pharmacy about that, but it would go off of that list of medications that she needs to address. So, and you can look at the history of Pharmacy Connect also from here. You can look at the schedule, so you can see what meds she's getting at what times. If she has a group of meds that you want to reschedule the time for all of those medications, you can just click reschedule, put in the new time and save it, and it will change all of those medications to that new time. And then this is a list of medications that she's been on in the past that she's no longer on, and your nurse can restart it from here. So it saves a lot of data entry if she can do that. So any questions on the, in here again, there's the blue manage button, so you can add a document type if it's not listed. Here's another way to do those nursing notes that we talked about earlier. The service plan would be all the services that you're providing for this client. So your nurse can come in here and add a new service, or whoever does their data entry can add in what service you're providing, how long it should take to complete that, when it's supposed to start. You can pick, is it every day, specific certain times of the day? Is it every day, 3 times a day, or is it certain days a week? So you can pick, maybe they get a bath on Monday, Wednesday, and Friday. You can indicate that, and then it would only pop up on their today screen on those specific days. If I put too many times here, I can just delete them and they go away. I can use specific times like 3 o'clock, 4 o'clock, 4:15, or I can just pick simplified times for services. I can for meds too, but we generally don't encourage that. But this would be like AM, PM, bedtime, kind of generalized times. And then who's going to perform that service? So, the PM home health aide person is going to help him get ready for bed at night. And then any specific instructions for your staff to know. They can look at the schedule. So again, they can reschedule a group of services. So, maybe these things at midday, they want to reschedule all of them, and they can just click reschedule and change the time, and it will change all of them. And you can also look at the history of any services that you've provided in the past for the client. Incidents, just